pro tip, we're not done talking about COVID yet. Gasp. So here's just a little story from a couple days ago. Probably went under a lot of people's radar because it's just an excerpt from a Trump rally. Like he held a rally in Wisconsin. Now, I don't know necessarily how long we're going to talk about this because it's really just an addendum to our previous story. However, I need to remind you. Let's take a look at this. There we go. If you'll notice, one of the worst areas in the country getting hit by COVID-19 right now is Wisconsin. It's looking pretty bad up there over just like the last little while here. Now, you might think, well, okay, but like, how bad is it really? I mean, like, after all, Donald Trump went to Janesville and told Wisconsin that it's key to winning the whole ball game. Packing thousands together in a re-election rally. And told everyone that the pandemic was rounding the corner. It's not a big deal. He can beat it, guys. He has it. He's clearly a Superman whose body it just won't quit. It's because he doesn't exercise, guys. Donald Trump has previously on the record stated that he believes that the human body has a finite amount of energy, like a battery. And if you exercise, you're actually using up that finite amount of energy. So he doesn't exercise in order to conserve his human battery, his human potential, which is probably what has allowed him to battle off this disease with ease, right? All of you fools out there exercising are just making yourselves more vulnerable to COVID-19. Or maybe the president's just a massive moron. Oops. Why? Wait, why? Why did the screen change? Anyway. The president didn't mention that Wisconsin is grappling with one of the worst coronavirus outbreaks in the country, with nearly 4,000 new cases reported just on Friday. Just on Friday! The day before his event, and a surge of infections that has pushed state officials to open a field hospital to give relief to hospitals in the northeastern part of the state. So Wisconsin literally doesn't have the hospital capacity in order to deal with the outbreak that they are currently experiencing. Instead, he focused on familiar subjects along the Trump campaign trail, like supporting law enforcement, border security, the economy, and said the state ought to move on from trying to contain the coronavirus. So, just to be clear, Wisconsin is currently experiencing a massive spike in the virus. People are literally dying as he is talking. And he's advocating that they stop trying to contain the spread of coronavirus. And also, not containing the spread has an effect on the economy. So, he's tying it in with the economy, like containing a massive pandemic is somehow bad for the economy, despite the fact that the economy won't recover until we contain the pandemic. A real catch-22 here. Border security, which I need to remind you, Mexico still has its border closed to the United States, as does Canada. And then supporting law enforcement, which is really all he has left now. But in his rallies, he's repeatedly and consistently talking about how the precious suburbs need to be protected. Now, he also is talking about how suburban women have gone towards him, and he's going to protect the suburban women. I need to remind you, and I am stealing this talking point directly from Vosh, that elections don't collect data on suburban women as a demographic. What he is saying, and what the suburbs have always been within politics, is a dog whistle for white. Because if you know about the creation of the suburbs, essentially what happened was black people moved into cities, and white people who were super racist got freaked out and moved out of the cities into the surrounding areas and created suburbs. In fact, the very first suburb was literally like a white enclave that denied black people the ability to enter and like live there. When the first black family moved into that area, there was literally a white mob that like harassed them and chased them out of their home. So like, yeah, suburbs have always been a dog whistle since then for white. And when he's talking about we need to protect the suburbs, we need to, you know, protect the suburban women. What he's saying is we need to protect white people. We need to protect the white women. Um, like we're this close from just open like white supremacist fascist speak. Okay, like we're this close to like advocating for like ethno states. On like from the president. It's really incredible. So like those are his talking points. His talking points are border security, which people don't want to come here right now because we literally have concentration camps for foreign people, and the economy, which isn't going to recover until we deal with the pandemic. And he's also advocating for us not to contain the virus, which we need to do in order for the economy to bounce back. And then his other talking point is just we need to protect the white women. So like that's what Trump has going on. I wish you had a Republican governor because, frankly, you've got to open your state up. You've got to open it up. Trump told the crowd. Trump told the crowd in a state that is currently experiencing the worst of the pandemic in the United States. Even though Wisconsin currently has no statewide restrictions on gatherings, businesses, or schools following recent lawsuits. So, if you've been paying attention to Wisconsin politics, which I have because I live next to Wisconsin, essentially, Republican lawmakers have been suing the state repeatedly to get them to open up, arguing that extreme measures to take the citizens of their state to make the citizens of their state safe in the middle of a pandemic are stupid and unconstitutional or whatever. Turns out a lot of Republican judges agree with them, and the restrictions that were in place in Wisconsin got lifted, which has now led to, a judge has for now blocked Governor Tony Evans' latest order to curb the spread of coronavirus by limiting public gatherings and the number of customers bars and restaurants may serve at one time. Very reasonable precautions that they are not letting through because they are in bed with businesses. But let's take a look at what the effect of this is, what the effect of opening up this state has been, and how things are going when it comes to health in Wisconsin in the middle of this pandemic. People are dying every night. Staff at overwhelmed Wisconsin hospital urge people to take coronavirus seriously. Melissa Reish has helped coronavirus patients FaceTime their family members to say goodbye and then sat with them as they died. David Eggman has listened to COVID-19 patients say their last words, including that they didn't realize it was as bad as it was, maybe because their president continually tells them that it's not very bad and that they should open up, and all of his Republican lackeys from the top to the bottom have followed suit because the party has completely capitulated to his fascist rhetoric. And Mallory Geese has had to disinfect the rooms of those patients after their deaths. They all work at Aspiris Wausau Hospital, one of the many healthcare facilities in Wisconsin that have been overwhelmed by the state's coronavirus surge. As of Friday, a record 1,101 people were hospitalized with the coronavirus in Wisconsin, including 274 people in intensive care units. At the beginning of the pandemic, Aspiris, which has 10 hospitals in its system, planned for up to 25 beds for coronavirus patients. They planned for 25 beds, so treating 25 coronavirus infections at a time. 1,100 patients have been hospitalized. in the state. And they have 10 hospitals in the state. So, like, I don't know if you guys know this about hospitals, but hospitals typically aren't built to accommodate warehouses full of people who are ill or sick. Typically, hospitals are built to accommodate, you know, maybe a couple hundred people max. And that includes like the broad range of things that they treat. So when a pandemic comes through, one of the goals is to keep the infection spread at a certain level, to keep it down low enough so that hospitals can manage their intake of new patients and not get overwhelmed and then run out of facilities with which they can treat these patients. So to that end, that's why states need to take the precautions to lower the transmission rates by mandating mask use, by closing down businesses, by limiting the size on gatherings in restaurants and bars, things like that. That's why we do these things, because otherwise hospitals get overwhelmed. And you know what happens when hospitals get overwhelmed? People start dying a lot from things that might not otherwise kill them. It turns out if you are very, very ill and in need of medical care, but there aren't medical beds, there isn't physical room in the hospital. Turns out you're much more likely to die, which is what we are seeing happen in these states that are telling you repeatedly. If you look at what the hospitals and the doctors and the nurses are saying, that they are overwhelmed. We've been adding a lot of beds. We have about 980 beds throughout the system that are COVID designated, and we only have about 18 left. So that means we have about 80 people in COVID right now that are pretty sick, said Matthew Haywood, CEO and president of at Aspiris. Most of Aspiris's COVID-19 patients are at its hospital in Wausau. Haywood said he and his team are trying to be as transparent to try and help people better understand the virus, which has killed 1,574 Wisconsinites so far. The virus may be out of sight, out of mind for some people. We're trying to help our communities see that this isn't just the flu and that it is a pretty serious situation. Now, I need to remind you that this is the head of a hospital who's telling you, this isn't even a doctor. He's literally the head of the hospital telling you that this isn't the flu, it's worse, and that it's a pretty serious situation that you also, dear reader or listener or audience, need to take seriously. Otherwise, more people are going to die, and that could include you and your loved ones. Yeah, he acknowledged Aspiris hospitals have at times reached capacity in recent weeks and said it has been transferring patients to other facilities, but has not yet needed to send anyone to the field hospital at State Fair Park. And keep in mind, this is one hospital system. There are other hospital systems in and around Wisconsin that they might transfer people to before relying on a field hospital that might have less up-to-date or up-to-code facilities in these current times. We want to keep our patients as close to home as we can, Haywood said. But the spike in cases is straining capacity and taking a toll on hospital workers. 215 members of the Aspiris staff were in isolation Thursday due to COVID-19, coronavirus symptoms, or exposure to someone who had tested positive in the community. So, again, I don't know how many members of Aspiris staff, or like how many people are on Aspiris' staff, but I'd wager that 215 is a huge number, like a huge percentage of it. Seeing people in the broader community not taking the virus very seriously is especially difficult for staff members. I think that the thing that's most painful for them right now and most challenging for them is that while they're working their butts off and they're working hard, it's the fact that they don't know if the community sees how serious this is, which it doesn't, because the president, who has a beeline on, again, about 30% of the population of the United States, who think that he is doing a fantastic job, keeps telling them that it's not a big deal and they shouldn't worry about it. And who are they going to believe? The President of the United States or doctors and hospital workers and nurses? Obviously you believe the President, right? Gosh. They see the politicization of it, and they see the repercussions of what's happening when they do their job every day. And they're watching people die. Reish, a registered nurse who works on the coronavirus medical unit, said she was initially seeing walking, talking, independent patients. Now we're seeing people needing high amounts of oxygen, needing to be repositioned, needing to be intubated. Reish added, family members are then deciding what they need to do. Do they withdraw care or do they keep them on full life support? And I need to remind you that, like, do they withdraw care or do they keep them on full life support? This is why we need to, by the way, decommodify healthcare and make it available to everyone without like having people paying money for it. Because this shouldn't be a choice that people are forced to make because they're too poor to keep someone that they love on life support, who may or may not still pull through. Um, this is a choice that is forced upon us by capitalism, and forced upon us by people who profit off of forcing that choice upon other people. And we could have a much better system where that choice is not a factor. Um, we just choose not to. The hospital is treating COVID-19 patients ranging in their age from their 20s to their 90s, she said. This doesn't discriminate against age. Um, I need to pull up a story for you guys. Let's see here. Yeah, here we go. Oh, nope. Well, I mean, that's a picture, but not exactly what I was looking for. There we go. Doo-doo-doo. Hmm, not finding it. But here, I'll just throw this up on screen so you can see. This guy, he is, or was rather, an Instagram influencer over in Europe. He got COVID-19. He posted pictures from his hospital bed uh, while having COVID-19. Look at how fit he is. Look at those abs. He looks like he's in ideal prime shape. Everybody. Um, he died a day after telling people that he was feeling fine and that his situation was stable. He's dead. He left behind his wife and three kids. Um, this thing is no joke, guys. It can kill literally anybody. It doesn't matter. It doesn't matter if you have pre-existing conditions or not. It can fucking kill you. Um, she urged people to wear masks, wash their hands, practice social distancing, and stay home, especially if they are showing symptoms. N95 masks do not absorb tears when you are at a bedside. Fuck. By the way, just so you know how my stream works, I do not read through, like, I kind of go through the articles to like see roughly, make sure I have a handle on what I'm talking about, but I don't read them in detail. I'm doing that with you live in real time, but that is fucking heartbreaking. Letting their family FaceTime them to say goodbye, and you sit with them as they take their last breath. And we're seeing it more and more frequently. Reish stressed that it was difficult for healthcare workers to call family members and talk with them about removing loved ones from life support. It's real world and it's here, and we as individuals can help prevent it, she said. Please help us save lives. Geese, who works with the hospital's cleaning crew, said it's emotionally difficult to disinfect a room after a patient dies. In housekeeping, we're on the front lines as well. And there's rooms where people have passed away. We go in and we have to clean, and it's not an easy thing to do when you know somebody just passed away in that room. She added, "We have to stay strong together." But Geese acknowledged that it doesn't always seem like people are looking out for each other in the community when it comes to preventing the spread of COVID-19. Becomes a little frustrating when you're outside and you see people going into stores, things like that, without a mask on, she said. Geese and her family said her family has been lucky and stayed healthy. I haven't lost anybody yet from COVID, but there's plenty of people who work here who have, she said. And so what we really want to get across in our message is to take this seriously, that people are dying from this. Eggman, who has a delightful last name, who's worked as a registered nurse for 20 years, said he thinks anyone who spent just 15 minutes with him on any given day would be taking every possible precaution to avoid catching or spreading coronavirus. It's not just about you, he said. It's about the people you care about as well. Eggman has also listened to the final words of COVID-19 patients. We have many patients who have come in here and their last words before he put a breathing tube in are they didn't realize it was as bad as it was. Because remember, once you have a breathing tube in, you can't talk, guys. We said some of the patients have wanted nothing else than to see their family members again. Because remember, if you get coronavirus, you go to the hospital, your family can't come in and visit you guys. You understand that, right? These people are dying alone. The only people around them are these hospital workers. I'm a grandparent and I'd like to see my grandchildren, Eggman said through tears. He added, by wearing a mask, you're protecting them as well as yourself. Please, if you're doing nothing else, please start wearing masks. Sanko, a registered nurse working with COVID-19 patients, said people are dying from the coronavirus despite the best efforts of healthcare workers. This is not something that you want to catch. This is not a way you want to die, she said. People are dying every night. There's nothing we can do about it. This virus is just beating them. Sanko said that all of her family events have been canceled because she's so afraid of catching it and passing it along to family members. She urged people to wear masks and practice social distancing. It's scary, she said. We need people to try to just not get this as much as possible. Guys. That was real rough. That was real rough. But this is a real problem, and this is the place. By the way, this is from Wisconsin. These are Wisconsinites talking about it. In this state that is currently experiencing some of the worst of the pandemic spikes currently in the nation. This is a place that has been so overwhelmed they have had to open a field hospital to send coronavirus patients to. The fact that the president goes to this state where people are literally dying every day, where they are so overwhelmed that hospitals literally cannot handle the amount of COVID-19 patients that are coming to them. And he has the audacity to dance in front of a crowd and talk about how the pandemic is rounding a corner and, it's not a big deal and that we need to stop focusing on it as much. You've got to open up even more despite the fact that Wisconsin is currently completely open due to Republican fuckery in the state. We need to get them out just on the pure basis, guys, of making sure that people can stay alive through this pandemic. He is one of the biggest contributors to the pandemic. Let me pull something up for you here, guys. Here we go. How Trump damaged science and why it could take decades to recover from nature. The president's actions have exacerbated the pandemic that has killed more than 200,000 people in the United States, rolled back environmental and public health regulations, and undermined science and scientific institutions. Some of that harm could be permanent. A really fitting picture here. Um, yes, here's what I was looking for. Nope, nope, this isn't what I wanted. Um, where is it? Yeah, here we go. This is not just ineptitude, it's sabotage, says Jeffrey Shaman, an epidemiologist at Columbia University in New York City, who has modeled the evolution of the pandemic and how earlier interventions might have saved lives in the United States. He has sabotaged efforts to keep people safe. The statistics are stark. The United States, an international powerhouse with vast scientific and economic resources, has experienced more than 7 million COVID-19 cases. Currently, we're over 8 million cases. And by the way, this was just written 2 weeks ago. Okay. We now have a million more cases than we did 2 weeks ago, guys. And its death toll has passed 200,000, more than any other nation and more than one-fifth the global total, even though the United States accounts for just 4% of the world population. Um, Shaman and others suggest that the majority of lives lost in the United States could have been saved had the country stepped up to the challenge earlier. Many experts blame Trump for the country's failure to contain the outbreak, a charge also leveled by Olivia Troy, who is a member of the White House Coronavirus Task Force. She said in September that the president repeatedly derailed efforts to contain the virus and save lives, focusing instead on his own political campaign. I have never seen such an orchestrated war on the environment or science, says Christine Todd Whitman, who headed the EPA under former Republican President George W. Bush. Um, like, guys, I'll throw this one up in the comments, but like the amount of culpability that Trump has for this pandemic is overwhelming. Yeah. Throw that up there. There we go. Just say, where is it? I'm trying to find a link to the actual. Here we go. Nope. Nope. That's not it. I'm looking for other lies, internet. Other lies. Here we go. Come on. Come on now. I want a link to the actual study. Internet, why aren't you giving me the actual study? Aren't linking to the actual study. I want to give you the data. I want to give you the data. Okay. Actually, I think I have it. Come on. It's the study. Nope. Nope. I all I want is one of these articles that I'm finding to link to the study that I know is in the New York Times article, but the New York Times article is behind a paywall. Um, there we go. There we go. Found it. Here we go. This is what I was looking for this entire time. Um, Coronavirus misinformation, quantifying sources and themes in the COVID-19 infodemic. The COVID-19 pandemic has unfolded alongside what the World Health Organization has termed an infodemic of misinformation. The study identifies and analyzes the most prominent topics of COVID-19 related um, misinformation that emerged in traditional media between January 1st and May 26th, 2020, based on a total sample of over 38 million articles published in English language media around the world. To our knowledge, our analysis in this first comprehensive survey of the traditional and online media landscape on this issue, we found that media mentions of of U.S. President Donald Trump within the context of COVID-19 misinformation made up by far the largest share of the infodemic. Trump mentions comprised 37.9% of the overall misinformation conversation, well ahead of any other topics. We conclude that the President of the United States was likely the largest driver of COVID-19 misinformation of the COVID-19 misinformation infodemic. Only 16.4% of the misinformation conversation was fact-checking in nature, suggesting that the majority of COVID misinformation is conveyed by the media without question or correction. So, yeah, we have a large problem in our media, which I would maybe direct your attention towards Fox News and their fact checks, especially given Tucker Carlson's recent attempt to debunk the use of face masks in hilariously inept fashion. And also, yeah, if you're getting your COVID-19 information from the President of the United States right now, just be aware that most of what he's telling you are just straight up lies and fabrications. Um, like for example, the talking point where like Dr. Fauci said you shouldn't wear masks, and while that's true, you can find a clip online from a 60 Minutes interview, like from again, like I think late March, so over 6 months ago. But since then, you can find infinitely more statements from him saying you should wear masks to save lives. So, like, the misinformation specifically spread by the President of the United States is staggering in its enormity. And the way it has shaped our conversation about this is nothing less than abhorrent and in my mind, should hold him to prosecution after he gets out of office. In a just world, he would be prosecuted for it now, but we don't live in that kind of society where the president is held accountable for his actions. So hopefully, Joe Biden wins and we can hold this bastard on trial because the sheer number of people he has killed with his rhetoric and disinformation and ineptitude is staggering and should be considered one of the biggest crimes ever committed against the American people by a president. Um, like, killing 200,000 of your own people is pretty despicable. Um, and it'd be one thing, and I've said this before, it would be one thing if he had been doing it out of like, you know, doing everything he could to prevent the deaths caused by COVID-19, and you know, the pandemic was just one step ahead of us the entire time. But the reality is that in the United States, if you look at us, especially compared to the rest of the world, like look at poor African countries, the entire continent of Africa has less COVID-19 deaths than the city of New York. So we're doing really poorly. In fact, if you multiplied the amount of deaths experienced in Africa by 100 times, it would still not be as many deaths as have been experienced, or um, yeah, as many deaths as have been experienced in the entirety of North America. Like, we're doing 100 times worse than an entire continent when it comes to COVID-19 related treatments and relief. And almost all of the blame for that goes at the feet of Donald Trump and the Republican Party, who has been supporting him throughout all of this to screw over and kill the American public.